The brain protein SNTF may help in diagnosing sports-induced concussions and aid in predicting the severity of brain injury-related symptoms, according to researchers in a recent study published November 2014 in Journal of Neurotrauma. According to the study, SNTF accumulates in axons after a traumatic brain injury. Axons are the long, thread-like tails of nerve cells that conduct electrical impulses from the body of one nerve cell to another. SNTF also increases in the blood after mild brain trauma, and it stays there anywhere from 1 to 144 hours after a concussion in players with persistent post-concussion symptoms. A previous study published in Frontiers in Neurology showed that in cases of mild traumatic brain injury, also known as a concussion, SNTF may aid in diagnosing damage to the white matter, the pale tissue of the brain and spinal cord that contains nerve fibers. It can also help predict persistent disability in CT scan negative post-concussion patients. The symptoms of mild traumatic brain injury may include dizziness, headache, loss of consciousness a few minutes after the accident, confusion, disorientation, nausea, vomiting, drowsiness, and sleeping more than usual, and loss of balance. Blurred vision, ringing of the ears, concentration problems, mood swings, anxiousness, and feelings of depression can also occur. Moderate to severe traumatic brain injury may cause seizures, loss of consciousness for several minutes to hours, severe persistent headaches, repeated nausea or vomiting, equal or unequal dilation of the pupils, draining of clear fluid from the ears or the nose, slurred speech, profound confusion, agitation, combativeness, and coma. Mild traumatic brain injury represents the most common neurological injury in the United States. In fact, in the US alone, 1.5 million people have this problem every single year, according to this said study in Frontiers of Neurology. The CDC states that there are about 200,000 cases of sports and recreation-related traumatic brain injuries every year. The activities that have the greatest number of concussions include playground activities, basketball, soccer, bicycling, and football.